welcome back to my YouTube channel, Ashley RN Takeover. Thank you guys who have been following me thus far. Thank you for watching. Thanks for all that good stuff. Thanks for liking, subscribing, and all that other good stuff. Alright, I haven't recorded in a little while and I apologize, but I've been a little bit busy getting some things in order. But now that those things are taken care of, I'm back. So today I'm really just going to be talking about why I chose nursing. Is nursing for me? Am I happy? Etc. And like, I was on Instagram and like somebody's commented on one of my things and it kind of like really inspired me. And I was telling them and explaining to them why like I chose this field. And I just wanted to do the same with you. Some of you guys may be struggling on deciding like if you want to do the nursing route, PT, OT, med school, whatever type of healthcare profession, and radio tech, surgical tech, all of these other medical professions. And I'm just going to give you a little bit insight as to how nursing has been fulfilling to me thus far in certain ways and how it hasn't in others. Okay, so to start, is nursing for me? Yes. I think that's the simplest answer for that question. Yes, I do think it's for me. However, I don't think bedside nursing, which is what I currently do, is for me. I've done management for a little bit. That really wasn't for me either. I thought it was a little bit too boring and too clerical in terms of like administrative work. And I like the interaction that I get at bedside, but at the same time, I feel like bedside nursing doesn't really allow me to flourish in the ways that I personally want to flourish. Okay, so what I mean when I say that, basically in short, is that, and this is me being real again, like I'm telling you how it is, like on a day-to-day basis, I don't really get to, like I see my patients, I get to interact with them, but I don't really get to sit there and, you know, be there the way that I thought I would be able to be there when I chose this field. Meaning that the reason why I didn't go to med school, which is what I was originally like considering doing, and like all my prerequisites was geared towards med school, was because I felt like doctors don't get enough interaction with the patients. They see the patients for like little 10-minute clinic type interactions. They get their little quick assessment in, and you know, they write some orders, and they, you know, I'm sure they do a lot more, and I of course I know that they do a lot more, but in my head, in terms of patient interaction, I didn't feel like that was what I wanted to do at the time. Now, fast forward now, working on my unit, I see my patients, I get to see my patients, but I feel like nursing is very task-oriented. And what I mean when I say that is, okay, you're checking orders, you're giving meds, you're placing Foleys, you're placing IVs, you're drawing labs, you know, you're signing paperwork, you're obtaining consent, you're doing all of these other things, and it's not as therapeutic as I anticipated being. And of course, if you choose to, and which I choose to on some days, you know, you get to sit and you can get to have like that 15-minute, 30-minute conversation with your patient, really see what's going on, really get an idea of, you know, their emotional state as well as their physical and mental and everything. You get that holistic picture by just talking to your patient. You know, one of the first things you learn in nursing school, like literally chapter 1, is therapeutic communication. You need to know how to talk to your patient before you can do anything else, which is something that I feel like a lot of nurses lack. I feel not that they lack therapeutic communication, but they don't really have the time to communicate therapeutically on a day-to-day basis. And it's not necessarily their fault, so to speak. You make time for the things that's important to you. I make time for it when I can, but being realistic, in the state of New York, we don't have mandated patient ratios and all that stuff. You know, on any given basis, you will have like a large patient load, and you're just trying to make sure that nobody dies and that you're providing the best patient care that you can in the time that you're giving with the amount of patients that you're assigned, you know. So you really have to think about, okay, do I have this 15-minute conversation with one of my patients and neglect my other patient who, you know, whatever is going on with them? Like, no, you prioritize and you just try to, again, provide the best possible care that you can for your patients in the time that you're given. And because we're not able to do that, for me per se, I feel like the job has become a lot less fulfilling for me. I like chatting with my patients. I like, hey, what's up? You know, I like when my elderly patients tell me a little bit about their life story, and they keep me there for a minute. You know, I like hearing those things. It's tedious to some and it's annoying to some people, but I like those things. It's annoying to me too when I know I have like a million and one other things to do and they're keeping me back. But at the same time, it's like I wish that I didn't have a million and one other things to do and that I could sit there and chat with my patient, which is why I'm probably gonna gear towards, not even probably, I am gearing towards an advanced practice degree, RN degree. And I feel like with the degree that I'm gonna choose, I'll be able to do exactly what it is that I've wanted to do thus far, that I felt like I really haven't been getting a chance to do. And I'll do a whole separate video on like whichever specialty I'm choosing and all of that other good stuff. But nursing, yeah, as far as like that type of fulfillment, you don't get that. You do get other, you know, like you get compensated in other ways. And when I say compensated, I don't mean like monetary compensation. I mean like a what do you call it? Like a fulfillment type of a compensation. Like okay, so maybe I don't get to talk to my patient for 15 minutes, but when I'm done taking care of my patient, at the end of my shift or at the start of my shift, I have a family member who's thanking me for like the care that I provided for their family member, and you know, you can see that they're truly grateful and that you just lit up their day, or you know, you do a simple task for your patient, and you know, they're thanking you and stuff like that. That gives me that's the kind of compensation that is supplemental, and that's kind of keeping me going at this route, and I mean at this rate, and you know, for the time being, which is cool. It's great, wonderful. Why I think that nursing is still a great field is because you see how like I feel like, okay, this particular field is not for me, like not healthcare field, but like this specific specialty, or like exactly what I'm doing is not for me, like bedside nursing. Okay, tomorrow if I wanted, literally tomorrow, if I wanted to go back into management, I could go back into management. If I wanted to go into law and focus on like healthcare and policy reform change and getting those staff ratios that we desperately need, like nurse to patient ratios that we desperately need, I could do that. If I wanted to do malpractice in nursing, I can do that. If I wanted to do nursing IT and I wanted to focus on like new technology for nurses to use that's going to benefit both them and the patient and just provide a seamless transition of care, like there's so many things you can do, and I feel like that's one of the reasons why I chose it, because I get bored quickly. And I'm bored now, honestly. I'm not gonna lie, I'm not sugarcoat. I'm bored doing what I'm doing because I feel like I've grasped this is a personal thing, like don't get me wrong, this is personal, this is super personal, but like I feel like I grasped all that I needed to grasp, like doing what I'm doing right now on this specific unit. You know, like on my last unit, I spent a year there, and I was like, okay, I feel like I might not know everything perfectly, and I may not know, you know, I'm not specialized in this specific field, like I don't know it like the back of my hand, but I know enough that I've gathered enough that I can take what I've learned and build on it and go somewhere else. Like I don't need to be like a master of this, you know, like they say, oh, don't aim to be like a master of a certain trade, just be like a, what is it, jack of all trades and master of none type of a situation. It's like one of those things, like cool, I got what I needed to get, it's time to move on in my life. And that's like really how I'm feeling in terms of that specific aspect of work. What am I saying? I don't know what I'm saying, but in terms of like working where I'm working on the unit that I'm working at, it's time to move on, and which is great. Some people say that you need to start up a med surg or like keep building. You don't need to do anything. Like, get this straight, you don't need there's not a necessity to do any specific anything. Like, you do what you want, you do what's best for you. At the end of the day, you are in charge of your own life, you are the captain of your own ship, and you need to keep sailing, which is what I'm doing. I'm sailing on to, you know, bigger and better things. Maybe not today, maybe not tomorrow, but it's in progress, and I feel like everybody should want to strive for more and strive for better. So I think I answered those two questions. Is nursing for me? Boom, yes, of course it is. Is this specific aspect for me? No. Am I moving on with my life? Yes. Am I seeking an advanced degree? Yes. Am I going to tell you what that degree is? Yes, in another video. Is nursing a great field and career choice? Absolutely. Are there multiple avenues of nursing? Absolutely. Will you get bored? Probably. But the great thing is that you can keep it moving and you can keep it pushing. I think like the topic, how I even got into this or how I got inspired to even do this specific video is because somebody posted, there's like a post on Instagram and it basically said like people who like things that get people mad. It's like, oh, people who quit every job they get and like they'll be the first ones to get another job, like they always have jobs. And I was like, yeah, well, like even since before nursing, I was always a firm believer in never ever ever, hear me when I say this, never ever ever, this is gonna be like one of Ashley's tips, never ever ever quit a job before having another job. Boom, that's it. Don't do it. It's a setup for failure. Okay. Number 2, always have a side hustle. You never know. I don't know if it's like the Jamaican in me, I don't know if it's like the New York hustler in me, but always have a side hustle. You never know in today's society, in today's economy, like things change and things switch up real quick. And I'm the type of person, I have a personality where if I'm done, I'm done. I need to, you get your you'll get your 2 weeks notice and I will keep it pushing. That's how that will go. So yeah, always have a side hustle. Never ever ever leave a job before having another job. And just, okay, this is probably the most important tip. Just because you have a job doesn't mean you should stop seeking opportunity. Just because you have a 401k, 403b, health benefits package plan, year contract, 2-year contract, whatever it is that you have, don't think that just because you have that you should just kind of be complacent in life and be like, okay, I'm good, I'm set, I have a job, I have stability. Great, you have a job and you have stability, but what are you going to do to grow? What are you going to do to better yourself? Do you want to be in the same position today, 2 weeks from now, 2 years from now, 2 months from now? That's how I always look at it. Anytime I get a job, I'm like, all right, this job is cool and all, I've been waiting for this job, I'm happy, I'm stoked, I'm excited, but at the same time it's like, do I see myself doing this 2 years from now? Hell no. Hell no. And that's just the truth. I'd be lying to you if I told you that I can see myself on my unit 2 years from now. And I mean, great, I know people on my unit, I know people, and this is nothing like bad about my employer, about my unit, anything like that. No, my unit is great. I honestly can say that I love the people I work with. It's a family. Sometimes you love them, sometimes you hate them, and that's just the reality of life. They're going to do things to piss you off, you're going to do things to piss them off, and that's just how it goes. But in reality, it's like, I don't even, that's like buying a t-shirt, right? And saying, I can see myself wearing this t-shirt every day for the next 40 hours a week for the next 2 years of my life. No, you don't do that with clothes. You don't do that with your meals. You don't do that with your gym routines. You don't do that with other aspects of your life. So what makes you think that you're going to do this with a job? Great, like I said, some people do it. I know people who've been on my units 20 years plus. I know people who are at that age of retirement, who have been on the unit, who have been working, who have seen, like, who know patients by the back of your hand because they're frequent flyers, and they come in and they can tell you their entire past medical history without even opening a chart. Like, great, that's cool for them, but for me, no. Like, I feel the need to always keep striving, always keep, seeking improvement, bettering myself, gathering knowledge, learning new things. Nursing is one of those fields, like, you're always going to have something to learn. You're always going to learn, You're always going to learn something new every time you go to work. Like, you are. This is a reality. This is a fact. But at the same time, you got to keep striving. And again, you have to wait and find out what niche is for you. Like, what I've been doing, like management, I did management. I told you guys that I worked in a short-term rehab. I worked in a like LTC, long-term care facility. I did pulmonary, and now I'm doing telemetry. And it's like, yeah, at every specific point in my time, point in my life when I picked those careers and when I picked those specific things and those jobs, it was for me at that time. But you realize that you need to keep growing, and keep going and growing and moving forward, and that's that. Like, nursing will be for you if it's for you. Nursing will not be for you if it's not for you. But like I said, there's other aspects. So don't just say nursing's not for me because you only see one aspect and you don't like that aspect, because again, there's a magnitude of different things that you can do in it. And honestly, they're reasonably attainable. Like, every aspect is reasonably attainable. You can switch reasonably. Like, you know, some people, like, take med school, for example, or take doctors, for example. If you're a surgeon, you specialize for surgery. Now, let's say you want to go into psych. It's gonna take, to me, or some might say, an unreasonable amount of time, resources, money, and education to switch into psych. Nursing is not that difficult in terms of switching specialties. Yeah, you have to get certified. Yeah, you have to take a few tests. Yeah, you might have to go to school, but it's cheaper, shorter amount of time, and reasonably attainable. So, I mean, you gotta do what's best for you. I'm just here to tell you that nursing's for me. It might not be for you. It may be for you. But do your research and never stop growing. Never be afraid to move forward. And some people, honestly, the reason why they don't switch units is because they're afraid of change, and they're afraid of challenges, and they're afraid of being great. And that's really what it comes down to. Are you afraid of being great? Like, are you complacent in life? Are you willing to take that leap of faith and, you know, be awesome? And that's what it comes down to. And I am, which is why, you know, things are working out for me. But they'll work out for you too. You just have to, like I said, do what's best for you. Anyway, that's it. That was my little chats with Ash. Again, thanks for watching. Thanks for subscribing. If you subscribed, if you didn't, I'm not gonna pressure you. You know, do what's best for you. I would like it if you do, but if you don't, that's cool too. If you like this video, give it a thumbs up. If you like a lot, share it maybe. Yeah. So thanks again. Ashley, Art and Takeover, and my Insta. I'm gonna leave it in the description box below because it has like a few underscores in it, and I don't think y'all gonna get it anyway. Anyway, bye.